Thank you, moderator, the chair of this session. Which one is that?
Yes, I think you will see with the buttons.
This one.
Oh, I think we have the. Is this correct?
Okay. Okay then.
Okay. And I'll just set this one right here.
Capacity building continues. My presentation is kind of combined between the two ministries, but the Minister of Water that I represented, we just kind of brief on what we are doing and how did we come together on this nutrition kind of platform with water. So nutrition is vested in the Minister of Health, and also Minister of Agriculture is part of it, and then we, the WASH Ministry, we join in. So in 2013, in July, that was the time when actually the working together on the sanitation linking with other sectors began. And it started by launching, and the ministries that are connected were together. I was in that launching as well. But this presentation is mainly from the Minister of Health. A colleague who was supposed to be here could not make it, so I'm presenting on her behalf. So the current, if we talk on current efforts on the Minister of Health, we have seen that the SUN movement roadmap is developed immediately after the joining the movement in 2013, July. And then there are some aspects of preparation to bring on board a consultant, because since that time, it did not move very well, these activities. So it's like there is a support that is going to come. I'm not aware whether it is the SUN paying for it. There will be a consultant to revitalize the activities of SUN in the Ministry of Health. So there will be a recruitment of, expected recruitment of a consultant to support the ministry. The Ministry of Health also is committed and to develop the nutrition-specific policy, meaning up to date, there is no policy that has been developed, strategies have not yet been catered for, and the enforcement and the standard have not yet been in place. Move the slide. The Ministry of Health have some good initiatives.
Peter, did you want to move to the next slide?
Yeah, next slide.
You can just do that.
Oh, sorry.
You're in charge.
Yeah. It have some initiative, what they call Boomer Health Initiative. And this Boomer Health Initiative will have a component on nutrition, which they said basic package of health and nutrition is embedded within that Boomer Health Initiative. We have 3 levels of the government. So we have the national government, the states, and the local government. And the local government, under the local government, there is counties, payams, and Boomer. And the Boomer is the grassroots level. So there is a need to establish this Boomer Health Initiative so that you start doing things from the bottom-up approach as it was presented yesterday. That is approach that is the Ministry of Health and the partners, which the government partners and the development partners as well. As we continue, we have seen some of the efforts through the partners, and there are some implementation that have taken place. So there are some activities that have taken place to tackle the severe acute malnutrition for children. And the activities that have been accomplished, 107,000 cases were treated from the children's side. And for the moderate acute malnutrition, for the lactated mothers and pregnant women, they have covered these 210,000. I believe the Minister of Health is being supported by the development partners to achieve these results. Sorry. Yeah, sorry. I have already gone through that. And according to the assessment, it was found that from the global acute malnutrition, above 15%, mainly in the conflict areas, were found out in some of the areas, the Great Upper Nile. That is the area that has been affected with the war that is started, internal war that is started in December 2013. And those areas that are affected are Upper Nile, Jonglei, and Unity. These are the areas that are affected heavily. Besides some of other states like Northern Bahr Ghazal and Warab, they are also affected with the malnutrition cases. So in the states of the Northern Bahr Ghazal and Warab, the year 2016, about 686,287 under 5 children and 316,218 the pregnant and lactated women are expected to be malnourished for this period that is ahead of us. There is no complete nutrition information which can give the picture of the country as baseline and tailored for action, meaning this is one of the major challenges that the nutrition is facing in South Sudan. We don't have yet the baseline, and that is a big challenge. You have to know where do you stand so that you can move now ahead. Regardless of the government's commitment, meaning that movement that was signed, joining the movement in 2013, the commitment was made by the different ministries and led by the Minister of Health. Those commitments were just in paper. There is no budget that has been allocated based on the commitment that has been put in place. So we have limited coordination system, meaning between the ministries, as I mentioned, there is no much activity that is actually moving on this activity as it has been committed by the different ministries. So the Minister of Agriculture and the Minister of Water and the Minister of Health, they are supposed to be actively coordinating these activities and bringing on board the development partners. But it doesn't mean that this coordination is not moving on. It means that there is no improvement of the activities that are going on. There is already support with the development partners. WHO, the World Food Program is moving on with the UNICEF on this nutrition, especially in the area that are affected with the crisis. So they are moving on. But the coordination part from our side, the government, is still not that very strong for the nutrition investment be harmonized. Due to the continued conflict and food security, the overall burden of acute malnutrition remains high. This is for the year 2016, as I mentioned earlier. What are the way forwards? Since I have mentioned already that there is weak coordination mechanism that exists, and that the nutrition has been dormant, the activities that have been committed to have been dormant for this period of 2014 fully, and to date, 2015, there's a need to strengthen the nutrition information system. Like comprehensive baseline should be done. And as mentioned earlier, there is a need to assign or recruit a consultant. And this consultant will basically basically will contribute to the baseline survey and monitoring, which can give evidence-based nutrition action. Second, there's a need for the advocacy towards access, coordination, and harmonization of nutrition investments. More emphasis to the revitalization and implementation of the SUN movement roadmap, which has been developed but is not very active. What is the way forward? Donors, as I mentioned earlier, and partners to focus on sustainable and developmental in line with the emergency responses. The figures that I mentioned earlier, they were actually done in mainly they were done by development partners, those figures. And for us to have a sustainable and developmental in line with the emergency response, there is a need to have these two, the development partners and the government, work to coordinate together. Support the capacity of the Ministry of Health and the other ministries, like the Ministry of Water that I hit, and then the Ministry of Agriculture, international community, share experiences and support the national stakeholders. So that means there is a need to have a kind of harmonization. And the development partners, the government, they come together and we support so that we move the agenda of nutrition in the country. Continued efforts on nutrition policy, strategy, and SUN movement. Why SUN movement? Because it is the movement that is encouraging, bringing on board this agenda of nutrition, nationally, globally, and at the global level. In terms of WASH, in relation to these activities, it is finished. Yeah. In terms of the linkages between WASH and the nutrition, we established what we call Sanitation and Hygiene Working Group under the leadership of the Minister of Water Resources and Irrigation. I'm the head for it. So we have already existence of 13 ministries, government institutions, that are coming under this body. And we need to do the same thing between WASH and nutrition. And nutrition already have the Minister of Agriculture actively involved, Minister of Health that is leading it, and us, Minister of Water, that we have already the ground of communication, the ground of coordination. But the agenda of nutrition has not yet been put in the very active role. And I believe my presence here is a part of the experience sharing with the global networking. And this is where now we can take this initiative at a national level in country. And I believe it is a very good chance. So whatever we have seen that it was not moving very well, from these lessons that we have learned, we need also to put our hands together with the Minister of Health and revitaliate the same commitment that have been signed for. Thank you very much.
Thank you very, very much, Peter, for that intervention. Just one quick comment, because I was very impressed by what you said at the SWA meeting the other day also, alluding to the challenges also of such a young country. I mean, the SUN movement, it's a sun rising, yeah, and the challenges that on the one hand you face just as any government does with the responsibilities you have towards your people, but at the same time building this new government, this new situation, all these coordinative efforts. And I think it's absolutely amazing that we have a person from the water ministry now doing the presentation on the health. So thank you very much for that. A round of applause, please.